All right, let's dive in. Today, we're going to take a journey deep inside one of the most vital systems in any animal's body, the respiratory system. We're going to follow the path of a single breath, starting at the nose, going all the way down into the lungs, and we'll see just how easily this incredibly delicate system can be compromised, leading to some really serious, sometimes even life-threatening conditions.
So here's our itinerary. We'll kick things off with the basics of how the system is supposed to work. Then, our first stop is going to be trouble in the nose and sinuses. After that, we're heading deeper down the airways, and we'll wrap up our journey way down in the lungs themselves to see what happens when they just can't expand anymore.
Okay, first things first. Before we get into all the ways things can go wrong, we kind of need a map of the territory, right? Understanding the basic layout of the respiratory system is absolutely key to seeing why it's so vulnerable to attack in the first place.
So this, right here, is our map. You can see the whole pathway. Air comes in through the nostrils, travels down the trachea, and then branches out into the lungs. The whole point is to get oxygen into those tiny little sacs, the alveoli, so it can be exchanged for carbon dioxide. But just look at how direct that path is. It's basically a superhighway for viruses and bacteria, leading straight from the outside world deep into the very core of the body.
So why does an animal actually get sick? It's rarely just about bumping into a germ. An infection really gets a foothold when the animal's natural defenses are already down, maybe from the stress of being moved. Or the bug itself could just be incredibly nasty and powerful. Sometimes a huge dose of a virus can overwhelm even a perfectly healthy system. And of course, if an animal's immune system is weak to begin with, well, that's a massive risk factor.
In this picture, it just perfectly captures that idea of a perfect storm. It's all a balancing act. You've got all this pressure from viruses and bacteria on one side, and on the other, you have the animal's own immunity and its stress level. When the pressure from the germs outweighs the animal's defenses, that's when you get respiratory risk, and that's the gateway to disease.
All right, let's make our first stop on this tour, the nasal passages. This is ground zero, right? The front door for every single breath. It's the first line of defense, and not surprisingly, a very common place for trouble to start.
So, our first condition is rhinitis. In plain English, that's just inflammation inside the nose. Think of that classic runny, stuffy nose you get with a cold. But in an animal, you have to ask, is this just a simple allergy? Or is it a warning sign for something way, way worse? That's the million-dollar question.
And this is an absolutely crucial distinction to make. On one hand, you have acute rhinitis. It's usually short, maybe from a virus or an allergy, and it clears up. But on the other hand, you have chronic rhinitis, and that is a whole different beast. This isn't just a stuffy nose that won't go away. We're talking about a sign of a deep, serious disease that can literally destroy the surrounding tissue and even bone.
For a veterinarian, the stuff coming out of the nose tells a whole story. At first, it might just be clear and watery, serous. But what happens when it turns thick and mucousy, or even worse, becomes mucopurulent, filled with pus, or has blood in it? Those are major red flags. That thick, pus-like discharge is a classic signal that a secondary bacterial infection has jumped into the fight.
Let's look at a really specific and dramatic example. In horses, there's this bacterium, Streptococcus equi. It doesn't just hang out in the nose. Nope. It travels to the lymph nodes in the neck and causes them to swell up with these massive abscesses. These swollen nodes then physically squeeze the trachea, the windpipe, and can literally choke the animal to death. That's why it's got such a terrifyingly perfect name, strangles.
I just love this quote from the source material because it gives you such a perfect mental image. After a long, chronic inflammation, the lining of the nose can form these fleshy growths called polyps. Now, they're not cancer, but they can get big enough to block the airway. And thinking of them as a peeled, seedless grape just perfectly captures what they look and feel like.
Everything's connected up there in the head. The nasal passages are directly linked to the sinuses, those air-filled cavities in the skull. So it's really no surprise that an infection in one spot can easily spread to the other. So our next stop is sinusitis. The fundamental problem with sinusitis is basically a plumbing issue. Think of it like a clogged drain. The sinuses are designed to drain mucus, but when inflammation or allergies make those openings swell shut, all that gunk gets trapped inside, and that creates this warm, moist, stagnant environment, which is an absolutely perfect breeding ground for bacteria and fungi. And what's really wild is how the cause can be totally different depending on the animal. In cattle, for instance, an infection can get right into the frontal sinus through an open wound from dehorning.
In horses, a rotted-out molar tooth can create an infection that travels straight up into the maxillary sinus right above it. It's crazy.
And this is exactly why sinusitis is so much more than just a headache. If you leave it untreated, the infection can literally eat away at the bones of the skull. Even worse, it can break through into the cranial cavity and cause deadly meningitis. Or it can push against the back of the eye, leading to blinding pain and vision loss. This is serious stuff.
Okay, time to move deeper into the system. We're going to follow the air past the sinuses and down the main pipeline, the larynx, the trachea, and the bronchi. These are the tubes that lead directly into the lungs.
Inflammation down here is incredibly dangerous, and it all comes down to real estate. These tubes are narrow. There's just not a lot of room, so any swelling can quickly close them off. In a disease like calf diphtheria, dead tissue can actually form a solid membrane that physically blocks the airway, causing the animal to suffocate.
I'm sure you've heard of kennel cough, but here's the thing that most people don't realize. It's not one single bug. It's actually a whole cocktail of different viruses and bacteria all attacking at the same time. And the result of that combined assault is that classic, harsh, hacking cough that comes from a super-inflamed trachea and bronchi. So, what's the long-term consequence of all this chronic damage to the airways? You can end up with a condition called bronchiectasis. The best way to think about it is like a rubber band that's been stretched out way too many times. The constant infection destroys the muscle and elastic fibers in the airway walls, and they lose their shape. They're left permanently stretched out, baggy, and pretty much useless for moving air.
Well, we've finally made it to our final destination, the lungs themselves. And down here, we're going to look at two major conditions that directly stop the lungs from doing their most important job, expanding and contracting.
First up is a condition called atelectasis. In plain English, it's a collapsed lung. It just means that the lung, or maybe just a part of it, isn't expanding. The tiny air sacs, the alveoli, aren't filling up with air, which means zero gas exchange can happen in that entire area.
So how does a lung collapse? Well, there are really two main ways it can happen. It's either getting squeezed from the outside, say by blood or fluid filling up the chest cavity, or it's getting plugged up from the inside by something like a tumor or an inhaled object that physically blocks the air from ever getting in.
And our final condition is emphysema. Now, this isn't a collapse. This is straight-up destruction. The walls between the air sacs are literally destroyed, creating these big, floppy, useless air pockets. The main difference between the types is really just where the damage starts. In horses, for example, that common condition known as heaves is a type of emphysema that begins in the tiniest little airways.
And that brings our tour to an end. We've traveled from what seems like a totally minor issue, like a runny nose, all the way to catastrophic lung failure. It really makes you think, doesn't it? Every single stop on this journey shows how a small problem can escalate into something huge. And it leads us with this really critical question. Where is that line between a manageable symptom and a full-blown, life-threatening crisis?